Hello, this is Dr. Eldred Taylor, and we're here again to interview one of our speakers for our annual American Functional Medicine Association conference at the Georgia World Congress Center in Atlanta, Georgia, November the 10th through the 12th, 2016. Today we have Dr. Dennis Wilson. Dr. Wilson is a leading medical expert on thyroid disorders. He developed the concept of Wilson's temperature syndrome. As a result of his clinical research and findings, Dr. Wilson developed the WT3 protocol for Wilson's temperature syndrome and originated sustained release T3. He is the author of Wilson's temperature syndrome, a reversible low temperature problem, Doctor's Manual for Wilson's temperature syndrome, and recently released evidence-based approach to restoring thyroid health. In November, Dr. Wilson will be speaking on an approach to normalizing the metabolic rate and eliminating symptoms of hypothyroidism. Dr. Wilson, we're so glad to have you here. Give us a little taste of what we may hear in November.
Hi, Dr. Taylor. Thank you so much for having me. It's a real privilege. I'm excited to be with you now, and also I'm really forward to this event in November. I'm really excited about it because it's one of those things where, important doesn't have to be complicated. Sometimes simple things can make a huge difference. And what we're going to be talking about in November is that so many of us as physicians, we were trained we all know that the metabolism is important and the metabolic rate is crucial to somebody's function. And we've been trained to look only at the TSH to determine what someone's metabolic rate is, or in other words, their thyroid physiology. But a lot of us also know that that's not adequate because so many of our patients that are on T4-containing medicine or that have hypothyroid symptoms, their TSH might be completely normal. And so then they complain to their doctors or their endocrinologist about it, and when we just focus on the TSH, we don't really have any answers for them. However, new research in the last 20, 30 years, especially in the last 10 years, new research shows that what is happening peripherally is is just as important, if not more commonly the problem, than what's happening centrally. In other words, it's one thing to have thyroid hormone production in the thyroid gland, and it's something completely different to have proper thyroid hormone uptake, conversion, and utilization in the peripheral tissues. And so the way we evaluate that's really simple. I mean, it's not just the TSH, it's not just thyroid hormone supply, we also want to look at conversion. And so it's a very simple process to do that. What I look at when I'm evaluating a thyroid patient for their metabolic rate is I'll look at their TSH and their body temperature. When you look at somebody's TSH, that gives you a pretty good idea of what I said TSH and temperature. Maybe I should have said their temperature and their TSH. The first thing I want to know when a person comes in is what is their temperature. If I'm suspecting a metabolic rate issue, then I want to know what their temperature is, because the temperature is the metabolic rate. It's an exact reflection of the metabolic rate. So if I'm wondering what their metabolic rate is like, I look at their temperature taken by mouth during the day. And if their temperature is low, then I know they have a problem with their metabolic rate, and that's when I look at the TSH to try to help me figure out where that problem is. If the TSH is high, then they might have a thyroid hormone supply problem. But if the TSH is normal and the person still has a low temperature, then that suggests a conversion problem. And fortunately, conversion problems are often completely reversible in a period of 2 or 3 months. So when doctors start looking at these parameters and start making sense out of what before doesn't make sense, I mean, if you're leaving out the body temperature, if you're leaving out the peripheral metabolism, you're leaving out probably more than half of the equation, because if you take all the people that have low body temperatures, probably 90% of those people have a peripheral conversion problem as compared to a central supply problem or primary hypothyroidism. In other words, hypothyroidism is epidemic right now, but Wilson's temperature syndrome or this peripheral conversion problem is 10 times more common than hypothyroidism. And when I tell people, like when I just recently talked to a couple of doctors who have heard of this, heard me lecture at some recent conferences, and they're so excited because they're now making sense out of, they're seeing huge differences and huge improvements in their patients because they're looking at the body temperature and they're making sense out of it, and they're using herbs and nutrients to improve the body temperature, and also they're using T3 therapy to get the temperature up and to reset the metabolism, and getting so much better results than they have, and it's making a huge difference in their practice.
And so you don't necessarily have to look at the basal body temperature. It's not the temperature when they first wake up. You can take their temperature anytime during the day when they visit your office. And are you using the 98.6, or what do you use as a bar that has where do you set the bar for the temperature during the day?
The temperature, there's a new study done in 2014 where they took some people who were euthyroid, normal body weight, and then they took some people who were obese patients, and they found that the obese patients tended to run about a degree lower Fahrenheit temperature than the normal weight patients. And they found that their temperatures upon rising were essentially, and their temperatures all through the night, were essentially identical to the normal weight people. The obese people and the normal weight people, their temperatures were identical at night. But the split happened about 3 or 4 hours after they woke up. That's when their temperatures dipped down about a degree and stayed down for about 7 hours. And so that's when we like to measure the temperatures, when that dip occurs or when it's likely to occur. And so if somebody wakes up at 7 o'clock in the morning, we have them take their temperatures at 10 o'clock, 1 o'clock, and 4 o'clock. And we have them take it orally because there's better heat transfer, and the heat capacity of water is better. There's just better contact, and and it's more convenient. It doesn't take as long. So we like to get an oral temperature with a glass thermometer. There's new thermometers with liquid metal alloys, that non-mercury thermometers. They're only like $6 or $7, but they can often tell you more than a $30,000 workup at a research hospital. Yeah, I actually had a patient like that. She went to a super famous, I'm not going to mention the name, but you can just imagine it's the top name in medical science as far as,
Yeah, I know who you're talking
about. The best of the best. And when we had a patient go there, and she got a $30,000. I mean, I didn't send her there, but she had gone there, and she got a $30,000 workup, and they couldn't find anything to explain all of her symptoms of hypothyroidism. Of course, they didn't think of them as hypothyroidism, but she had all the symptoms, and they didn't find anything, and they sent her home to basically, live the rest of her life with those symptoms, and maybe some psychiatric help or something. But we gave her the thermometer. It was a $6 thermometer, and she went home and she had a low temperature, and we treated her for it. And 3 weeks later, her symptoms were gone.
Yeah, I know. And if she went back up to the Mayo Clinic, I'm sure that they would chalk it up to placebo, or she has some type of mental issue or whatever. But yeah, and it's just like you said. Sometimes simple is the best. It's a lot of times the body is not as complicated as we try and make it.
Yes, that's right. And we know that temperature is important. It's one of the 4 vital signs.
Right.
You have And the four vital signs, three out of the four vital signs have to do with rate or speed. You know, you have heart rate,
Mhm.
respiratory rate, and metabolic rate and blood pressure. But yeah, it's important.
Yeah. Well, Dr. Wilson, we appreciate you joining us for the interview this afternoon. You were one of our speakers last year that probably most of our attendees were interested in finding out more about what you do and how you treat thyroid issues. And again, sometimes people think it's so simple that it couldn't work, but again, you've been doing this and teaching this a long time. I've been using T3 for a long time and have kind of have discovered that TSH doesn't tell us as much as a lot of doctors think it tells us. But but anyway, again, thank you so much. We look forward to seeing you in November at our annual American Functional Medicine Association conference from November the 12th through I'm sorry, November the 10th through the 12th at the Georgia World Congress Center. Dr. Wilson, thanks so much for taking time out to talk to us and our prospective attendees. And again, we look forward to seeing you in November.
My pleasure, Dr. Taylor. Thanks for having me. I look forward to seeing
Okay.
you all in November. Okay.
Okay. All
Bye.
right. Thank you. All right.